Welcome. I have really enjoyed being here, working with y'all, with the guests that you serve. And it is truly a privilege to be among you. And I want to begin by saying thank you for all that you do. Now, the program is called Creating Bridges, helping each other to heal from trauma. And I want to begin by saying that when I ask folks, what would the world be like if everyone knew what folks learn that work with me? Their answer is often, Patty, there would be no war. There would be no violence. That would be an awesome world, wouldn't it? So creating bridges, helping each other to heal from trauma. The reason for the videotape. There we go. Too many individuals suffer too long when there are treatment methods that work. There are way too many people in our country who have PTSD and suffer for years from PTSD when it is very treatable. Thus,
everybody's phone needs to be off. I'm sorry. Thank you.
Thus, it is my hope that this video can be shared in an attempt to better ensure no one is left behind. This is how most of us spend life. Having no idea of tools that can quickly make a large difference. We can help each other make the shift to go from stressed and unable to function to being in the driver's seat. Dr. Albert Schweitzer, who won the Nobel Peace Prize, he stated, patients carry their own doctor inside. They come to us not knowing that truth. We are at our best when we give the physician who resides in each patient a chance to get to work. This is the foundation of every single thing I do in working with people. Because I am always amazed at what people are able to do to help themselves. The goals of creating bridges: gain understanding of the impact of trauma on individuals, develop techniques that you can use to assist yourself in developing resiliency, develop ability to assist others in overcoming the negative effects of trauma, develop understanding of interventions that actually work in treating PTSD. A study of 115 homeless veterans, 98% reported exposure to one or more high magnitude stressors. PTSD symptoms and military and civilian traumatic stressors of all types should be assessed in homeless veterans because they may be contributing to poor social and occupational functioning. That was in military medicine. The link between homelessness and PTSD. This is a problem internationally. Even in Sydney, Australia, 70 homeless men and women were randomly sampled. 98% had experienced at least one traumatic event in their lifetime. The average number of traumas per person was 6. And that was in the Pennsylvania State University publication. Now, according to the National Center for PTSD, traumas happen to many competent, healthy, strong, good people. No one can completely protect him or herself from traumatic experiences. People who react to traumas are not going crazy. They are experiencing symptoms and problems that are connected with having been in a traumatic situation. The National Center for PTSD. Having symptoms after a traumatic event is not a sign of personal weakness. Many psychologically well-adjusted and physically healthy people develop PTSD. Probably everyone would develop PTSD if they were exposed to a severe enough trauma. When a person understands trauma symptoms better, he or she can become less fearful of them and better able to manage them. Important facts. PTSD is not a result of something being wrong with an individual. It is a result of exposure to a traumatic event. Education on trauma symptoms and effective treatment is critical. Now, some traumas that I've worked with. In my opinion, whenever you go to a doctor or a therapist or anyone, it's good to know what their background is. Domestic violence, assault, shooting, stabbing, beating, rape, sexual abuse, forced sex act, robbery, home invasion, bank robberies, violence associated with cult and gang activity, witnessing a suicide, witnessing a murder or accidentally causing a death, traumatic death of coworker, friend, or loved one, severe car crash, serious injury or illness, Charlotte Speedway collapse, fires and bombings, traumas related to occupation like fire, police, military, being kidnapped and held hostage. Too many to list. Now I want you to think for a minute. If the interventions that you're going to learn about today can help people who've dealt with these kinds of traumas, what kind of a difference can it make for you? An official diagnosis of PTSD, trauma exposure, death, threatened death, actual or threatened serious injury, actual or threatened sexual violence. Exposure to trauma, direct exposure, witnessing the trauma, or learning that a relative or close friend was exposed to a trauma. Indirect exposure to aversive details of the trauma, usually in the course of professional duties, first responders, fire, police, medics. Importance of expanding the view of trauma. And I think this will get to what you were pointing out. Consider exposure to trauma through media. I've worked with people who developed PTSD by watching 9/11 on the news. I've worked with folks who went through 9/11 and the aftermath, and I've also worked with folks who got PTSD symptoms from seeing it in the news. victims, witnesses of verbal abuse. A lot of times the trauma work we do is about healing from verbal and emotional and physical abuse. Abandonment can cause tremendous trauma. Individuals experiencing severe medical problems, operations. I work with a lot of cancer patients, MS, fibromyalgia, migraines, IBS, etc. My definition of trauma: any experience that gets stuck in the brain and continues to impact an individual in a negative way. I want to repeat that. My definition of trauma is any experience that gets stuck in the brain and continues to have a negative impact. When a disturbing event occurs, it can get locked in the brain with the images, original picture, including all 5 senses, thoughts, beliefs, feelings, and body sensations. For the official diagnosis of PTSD to be made, at least one re-experiencing symptom: unwanted, upsetting memories, nightmares, flashbacks, emotional distress after exposure to reminders of the trauma, physical reactivity after exposure to reminders of the trauma. Re-experiencing is the brain actively struggling to cope with a traumatic experience. Symptoms are automatic, learned responses to reminders of the trauma. Survivor experiences the same mental, emotional, and physical experiences that occur during or just after the trauma. I think we really want to take a moment and just realize what that statement means. Not only does somebody go through a horrific experience one time, but until the trauma is healed, when it is triggered, when they re-experience it, they're going through the same mental, emotional, and physical experiences. I hope that touches your heart as much as it does mine. The survivor usually can't control these symptoms or stop them from happening. Triggers, reminders of the trauma, can occur while asleep or awake. Leads to intense distress in the mind and in the body. Leads to acting or feeling as if the trauma was happening again. Now let's talk about avoidance of trauma. At least one of the following in the PTSD diagnosis: trauma-related thoughts or feelings, trauma-related reminders. People avoid the thoughts, the feelings, the conversations associated with the event. They avoid places, activities, people that remind them of the event. They have difficulty in remembering information related to the trauma. And they isolate socially. Avoidance of remembering the traumatic event. One can have difficulty remembering the trauma even when it is the cause of one's symptoms. Probably the majority of the people that I work with who have PTSD do not come into my office saying PTSD is causing my symptoms. Trauma is causing my symptoms. One may not even realize that behavior is motivated by a repressed memory. Negative thoughts or feelings that began or worsened after trauma in at least two of the following ways. Inability to recall key features of the trauma. Overly negative thoughts and assumptions about oneself or the world. Exaggerated blame of self or others for causing the trauma. Negative affect. Decreased interest in activities. Feeling isolated. Difficulty experiencing positive affect. Feeling emotionally numb. Decreased interest or involvement in activities one previously enjoyed. Feeling detached from others. Unable to have loving feelings even for those close to the individual. Feeling that one's future will be cut short. Trauma-related arousal and reactivity that began or worsened after the trauma in at least two of the following ways. Irritability or aggression. Risky or destructive behavior. Hypervigilance, being super alert, watchful, or on guard. Startling easily, feeling jumpy. Difficulty concentrating. Difficulty sleeping. PTSD symptoms last for more than 1 month. They create distress or functional impairment, socially and occupationally. And it's not due to medication, substance use, or other illness. Not officially diagnosed until at least 6 months after the trauma, but the onset of symptoms can occur immediately. Depression may occur due to losses connected with the trauma, feeling overwhelmed by symptoms, social isolation. And symptoms of PTSD can lead to communication problems. A lot of people that I work with come in with the chief complaint being communication. They're startled by loud noises. They're startled by something or someone coming up on you from behind when you don't expect it. There's anger, there's agitation. There's reenactment of trauma and abuse, feeling the need to defend oneself. Constantly on the lookout for danger. Can't let the guard down. Have to keep the guard up. Never feeling safe. Hypervigilance can be viewed by others as excessively controlling, demanding, perfectionistic. It leads to resentment. Social isolation, attempt to avoid reminders of the trauma, difficulty with trust, not feeling safe. Feeling emotionally numb, being unable to have loving feelings even for those close to the individual. Is it any wonder that folks with PTSD, until it's treated, have marital problems, have relationship problems, difficulty in trusting others, even those who are close to the individual. PTSD leads to sleep problems, connected to the belief I can't let my guard down. I've got to keep my guard up. Some folks are prescribed a boatload of sleeping medication. when they have PTSD. The subconscious mind is more powerful than medication. So therefore, the sleep doctor refers the patient to me. When we heal the memory associated with, I have to keep my guard up, I can't let my guard down, suddenly they can sleep. Suddenly they no longer need medication to sleep. Nightmares or avoidance of nightmares by not sleeping. If one cannot relax, how can one sleep? Role of insomnia. Insomnia can increase physical pain, and physical pain can lead to insomnia. Depression. Insomnia can make depression worse, and a symptom of depression is insomnia. Anxiety. Insomnia is both a symptom and a contributing factor. So how important is a good night's sleep? Well, failure to get a good night's sleep leads to poor concentration, increased memory problems, decreased physical abilities, reduced ability to perform cognitive functions such as with math. Can also lead to absenteeism, accidents, errors, injuries, even fatalities. Sleep plays a role in regulation of arousal, processing of traumatic memory. Now, sometimes when folks have PTSD, people complain and they say, well, this person is not motivated. I want you to think about this for a minute. They have decreased interest in activities previously enjoyed. So what would have previously motivated them no longer motivates them. Feeling as a future will be cut short. Trouble concentrating or thinking clearly caused by lack of sleep or other symptoms. Now let's talk about habits. Alcohol and drugs may be used to self-medicate. Addictive behaviors may be associated with reenactment of how one responded during or immediately after the trauma. If somebody has a traumatic event to happen, and then they start drinking or using drugs, that habit is hooked in with the PTSD. And the PTSD must be treated to help with recovery. High-risk activities may be associated with craving adrenaline rush. Thus, healing from trauma may be a necessary part of recovery from addiction. The story I tell a lot in my office. I want you to imagine that you're on a burning ship. You put on a life jacket, you get in a lifeboat. You think it saved your life. Then when you hit land, you have a hard time taking the life jacket off, setting the lifeboat down. Whatever you attribute with helping you immediately after a trauma oftentimes gets reenacted. Okay. Now, individuals with PTSD have often been hurt, betrayed, injured, abandoned by those they thought they could trust. Thus, developing the ability to trust those who are there to help is critical for but often difficult. If somebody was abused by a parent that they should have been able to trust, how can they easily trust you? What concerns me the most, large number of individuals suffer in silence and delay obtaining effective treatment. When you consider that most of the individuals that I have met had no idea that PTSD could be treated quickly and effectively, the above makes sense. That is why education on what PTSD is and what treatments work is so critical. Now I want to talk for a minute about PTSD and chronic pain. We are also known for our work in the pain field, in pain management. And I think a huge part of that is because we totally get this concept that PTSD and chronic pain are often mutually maintaining conditions. PTSD and chronic pain can increase the symptom severity of either condition. Pain can be related to re-experiencing. And this is a piece that I really hope everyone will get. And I really hope that all physicians who treat pain will get. When you have a trauma that involves a physical injury, the re-experiencing often includes re-experiencing the pain. When you process and heal from the trauma, you can oftentimes have decreased or no pain afterwards. Some of the things I've seen in this area have been quite amazing. Pain can be the result of trauma. Pain can be traumatic. When people have excruciating pain, that can get logged into the nervous system like any other trauma. And you can have re-experiencing. And that comes from the Journal of Rehabilitative Research and Development. Other health conditions, are they sometimes a re-experiencing of trauma? How did the body react during trauma? If these physical sensations reoccur, what dis-eases might develop? Consider impact on breathing, heart, digestion, inflammation. When we help people to heal from trauma, we oftentimes see improvement in all of these areas. Now, I do a lot of work in terms of storytelling and using symbols and metaphors. And I will oftentimes talk about the bathtub. Water is either overflowing on the bathroom floor, or you can't get any water out of the faucet. You're either flooded with emotion or your emotions are cut off. Emotional regulation is a critical skill that is taught in effective PTSD. Now, secondary traumatization can occur when listening to a trauma survivor retelling the story. One can experience all the symptoms of PTSD without actual exposure to the trauma. Can lead to burnout. Warning signs: feeling emotionally exhausted. Depression, guilt, feeling of hopelessness, decreased empathy towards others, resentment towards others for demands placed on you. Any symptoms of PTSD. Now, the next step. Successful treatment of PTSD includes self-care, both for those who experience PTSD and for those who care for them. Now I'm going to show you a video, or rather Bill is going to help with showing a video. And then I'm going to teach you a technique. And then you'll have the opportunity to practice the technique with each other. And this is really the heartbeat of what I hope for y'all today. I hope for y'all that you will learn tools that will make a huge difference, not only for yourself, but with other people.